Rheumatoid arthritis. The best treatment options. Rheumatoid arthritis is a chronic inflammatory disorder that usually affects the lining of smaller joints like fingers and toes. With time, it can even affect the knees, ankles, elbows, hips and shoulders. Eventually, it can result in bone erosion and joint deformity. It is more common in women than men. It is usually diagnosed in people over age 40, however, younger adults and even children can have it. Other risk factors include family history, environmental factors like smoking, exposure to silica mineral and chronic periodontal disease. Also known as RA, rheumatoid arthritis is an autoimmune disease in which the immune system mistakenly attacks the lining of the membranes that surround the joints, synovium. It is not known what starts this process. Symptoms of RA come and go. When the body tissues are inflamed, the disease is active and leads to symptoms including muscle and joint aches, swelling, morning stiffness, and fatigue. When the tissue inflammation subsides, the disease is inactive and symptoms go away. There is no known cure for RA. However, medicines as well as many home remedies can ease the symptoms and provide relief. Treatment. Medications. The types of medications recommended by your doctor will depend on the severity of your symptoms and how long you've had rheumatoid arthritis. NSAIDs. Non-steroidal anti-inflammatory drugs, NSAIDs, can relieve pain and reduce inflammation. Side effects may include ringing in your ears, stomach irritation, heart problems, and liver and kidney damage. Steroids. Corticosteroid medications reduce inflammation and pain and slow joint damage. Side effects may include thinning of bones, weight gain and diabetes. Doctors often prescribe a corticosteroid to relieve acute symptoms, with the goal of gradually tapering off the medication. Therapy. The therapist may also suggest new ways to do daily tasks, which will be easier on your joints. For example, if your fingers are sore, you may want to pick up an object using your forearms. Surgery. Rheumatoid arthritis surgery may involve one or more of the following procedures. Synovectomy. Surgery to remove the inflamed synovium. Synovectomy can be performed on knees, elbows, wrists, fingers and hips. Tendon repair. Inflammation and joint damage may cause tendons around your joint to loosen or rupture. Your surgeon may be able to repair the tendons around your joint. Joint fusion. Surgically fusing a joint may be recommended to stabilize or realign a joint and for pain relief when a joint replacement isn't an option. Total joint replacement. During joint replacement surgery, your surgeon removes the damaged parts of your joint and inserts a prosthesis made of metal and plastic. Alternative medicine. Tai Chi. This movement therapy involves gentle exercises and stretches combined with deep breathing. Fish oil. Some preliminary studies have found that fish oil supplements may reduce rheumatoid arthritis pain and stiffness. Exercise. Regular exercise is one of the first steps you need to take to fight rheumatoid arthritis symptoms. Exercise will help reduce fatigue, strengthen muscles and increase range of motion. Plus, it will reduce the risk of developing osteoporosis and help fight depression, which can plague anyone coping with RA. 3 types of exercise are very helpful. Range of motion exercises should be done for at least 30 minutes daily. Strengthening exercises should be done 2 or 3 times a week. Endurance, cardio or aerobic exercises should be done for at least 30 minutes, 3 or 4 times a week. If needed, consult an expert about how to start an exercise program and which types of exercises to do and avoid. Hot and cold compresses. Alternating hot and cold compresses can also help deal with symptoms of rheumatoid arthritis. While a hot compress will reduce pain by relaxing sore muscles and joints, a cold compress will dull the pain and reduce joint swelling and inflammation. Wrap a hot water bag in a towel for the hot compress. Wrap some ice cubes in a thin towel for the cold compress. Place the hot compress on the affected area for about 3 minutes. Remove it and immediately put the cold compress in its place for about 1 minute. Repeat the process for 15 to 20 minutes a few times daily until you get relief. You can also use these compresses separately. Avoid hot compresses if the affected area is red, hot and irritated. Do not use cold therapy if you have circulatory problems. Massage. When done properly, massage can relax stiff muscles and provide relief from pain due to rheumatoid arthritis. Massage will stimulate blood circulation, which is important to alleviate discomfort and inflammation. Add 10 grams of camphor to 1 cup of mustard oil and heat it until the camphor dissolves completely. Allow the oil to cool and then use it to massage the affected area with gentle strokes. You can also add a few drops of lavender oil to some warm olive oil and use it to massage the affected area with gentle strokes. You can massage the affected area 2 or 3 times a day for a few minutes each time. Avoid massage if your joints and muscles feel too tender. Tips. At least once a day, move the affected joints through their full range of motion. However, do not overdo or it may cause pain. Avoid situations that are likely to strain the joints. Learn to use your body parts in such a manner that reduces stress on the joints. Use tools and devices to carry out daily tasks and activities easily. Rest whenever you feel the need. Avoid keeping the affected joints in the same position for too long. While at work, make sure to take a short break every hour. If you are overweight, losing weight will help the joints feel better. Follow a healthy diet. Make sure to get enough vitamin D, vitamin C, iron, calcium, potassium, magnesium and omega-3 fatty acids. Quit smoking to reduce the risk of rheumatoid arthritis complications. Stop drinking as it may worsen your condition. Keep a positive attitude and thoughts to distract your brain from feeling pain. Join a laughter club to bolster the immune system and increase the ability to handle pain. Eat a few canned, frozen or fresh cherries on a daily basis. Take a warm bath or shower in warm water for 10 to 15 minutes before going to bed to enjoy sound sleep. Drink 2 to 3 cups of green tea daily. Techniques like hypnosis, guided imagery, deep breathing and muscle relaxation can all be used to control pain. You can also try acupuncture to reduce pain and help your body relax.